I will be presenting on Katharine Kolcaba's theory of comfort, first developed in the 1990s, which focuses on the significant role of a nurse to provide immediate comfort to clients. Her initial work on this theory began through her own clinical experiences with clients living with dementia and insights she received on the prioritized concept of comfort. Katharine developed this practical theory so that comfort would be a product of holistic nursing art. This is a middle-range nursing theory that demonstrates the process of optimal and continual provision of comfort with ongoing evaluation measures to assess the effectiveness of care. The holistic nature of comfort. While there are a plethora of definitions for comfort, comfort may be defined as receiving effective care that addresses specific needs: pain, nausea, itching, anxiety, isolation, depression. For clients, there is a strengthening aspect of comfort when comfort needs are met. Comfort is a basic desired need by human beings that requires immediate attention by the attuned, intuitive nurse. There are three modes of comfort: relief for unmet comfort needs. For example, post-operative pain is relieved by the administration of a prescribed analgesic. Ease, contentment, and tranquility. After an anxiety-provoking crisis, it's the state experienced when some or all of the causative factors of anxiety are attended to. Transcendence. The motivation, confidence, coping ability, and hope to move and rise above the situation when the pain isn't able to receive full relief. The holistic approach to comfort care addresses four contexts: physical, which is the bodily and homeostasis functioning, that focuses on bodily sensation and physiologic problems connected with a medical diagnosis; psychospiritual, inclusive of one's self-awareness, life's purpose and meaning, and spiritual connection with a higher being; environmental. The environmental umbrella includes the setting, surroundings, and external influences: color, temperature, light, noise. The environmental component may be manipulated to enhance a client's comfort. Social-cultural focuses on the client's relationships with family, friends, co-workers, and a client's cultural beliefs, values, and traditions. A holistic approach emphasizes the interconnectedness of the components of comfort and how it is provided. The whole is greater than the sum of the individual parts. Holistic comfort is the immediate state of being strengthened by having needs for relief, ease, and transcendence addressed physically, psychospiritually, social-culturally, and environmentally. A nurse's understanding of a client's comfort directly affects the provision of nursing care, and clients look to nurses for support in attaining comfort. The presence or neglect of comfort for a client is frequently addressed as a challenging, pressing issue in nursing practice. Nursing interventions and intervening variables are integral concepts to the theory of comfort. Nursing interventions are comfort measures designed and implemented by the nurse to address the specific healthcare needs. These interventions are intended to improve the client's immediate comfort: relief of nausea, itching, sharp pains, level of anxiety. The intervening variables are those factors such as age, attitude, finances, education, culture, support system that the clients present with and are unchangeable by the nurse. These variables have an impact on the effectiveness of the nursing interventions. How effective is comfort theory? A taxonomic structure, also known as the comfort grid, was developed to support assessment, measurement, and evaluation of client comfort. This comfort grid guides the process of assessing the client's specific comfort needs, developing and implementing appropriate nursing interventions, and then the important step of evaluating client outcomes to see if they are positive and if comfort has been experienced and to what degree following nursing interventions. An ongoing comfort assessment and evaluation after implementation of interventions compared with a baseline is necessary when applying the comfort theory. Utilizing the comfort grid to determine changes in comfort level over time necessitates at least 2, but preferably 3 measuring points. Measuring comfort is assessed both objectively and subjectively. Use of comfort questionnaires. Several have been designed. For example, there's a Comfort Daisies visual for use with young children, a Healing Touch Comfort, Hospice Comfort, Childbirth Comfort questionnaire, a visual discomfort. The relevant one must be selected for the client and their family's specific situation. Clients are assessed by asking them if they're comfortable, and by asking them their total comfort on a scale of 0 to 10, 10 being the most comfortable and 0 being the least comfortable. Purpose and application of the theory of comfort. The purpose is to assess and identify a client's comfort needs, address them with interventions to increase a client's holistic comfort, provide appropriate comfort for clients and their families. This theory has been chosen often as a guiding frame for nursing clinical areas such as labor and delivery, cardiac catheterization, critical care, hospice, and many others. Case study. A 27-year-old prima gravida at 40 weeks plus 4 days is admitted to the hospital with contractions 8 minutes apart and her membranes ruptured 3 hours ago. The laboring client says she can't bear the pain anymore. She hasn't attended any prenatal childbirth education classes, and her husband is her only support person. The client's husband appears anxious and uncomfortable with being present in the birthing room. Here is a visual comfort grid that shows the taxonomic structure of comfort applied to this case study. As we see with the physical, there's relief needed for labor pain, nausea, and safe pain relief options. Ease for physical needs can be given through massage, changing position, pillows, limiting and avoiding food, reducing fluid intake, and offering sips of ice water. And transcendence to rise above the pain that she's experiencing with encouragement, coaching, and that the client begins to think, I can tolerate this and I can rest between contractions. For the psychospiritual, relief of anxiety, fear by offering coaching, encouragement, and explanation of the laboring process. To bring her ease and contentment, deep breathing, prayer, support visual imagery, and allowing her to find a focal point. Transcendence, that she feels supported, safe, regains control, and both her and her husband have reassurance. The client's environment, relief is given through repositioning, massaging, warm shower. There's bright lights, hallway noise, and minimize internals. Ease is given with positive distractions, playing her favorite music, lowering the bright lights, quietness, and reducing the room temperature. For transcendence, that she and her partner focus on one contraction at a time and encourage her with the progress made. Create a calm, positive ambience and remove the focus on time. Social cultural, relief is given through information and education as needed and avoiding information overload. Provide support for the client and her husband with family, a doula, a midwife, and encourage the husband to engage at a level that he feels comfortable and that he maintains connection with his wife and cheers and supports her. Transcendence, support the couple. Prayer is helping them and strengthening them, and that they would find other ways that are helpful through the laboring process. Prioritizing and enhancing client comfort. There are a multitude of opportunities in a nurse's everyday practice to apply the concept of comfort care. Exploring and deepening one's understanding of this often implemented theory of comfort will enable nurses to formally study the phenomenon of comfort and determine effective care practices that will enhance clients' comfort. Kolcaba's theory has the potential to prioritize clients' comfort and restore it to the forefront of healthcare.